back to my channel. So I did a little bit of a poll on Instagram with regards to whether I should do all my updates on one video or whether I should do it on several different types of videos, and we had a substantial amount of people stating that I should do it as all in one video, so that is what I'm going to do. So as you guys probably know, especially if you follow me on Instagram, I've not been very active, I'm going to say, on social media for the past few weeks. Reason being, I have had my children off school for the 6-week holiday because it's summer here in the UK, so the kids are off school, and also because I have been dealing with a lot. So roughly around just as when the kids were finishing school in July, I started my irrigation, which you've probably seen a few videos about how I use the devices and stuff, or at least how I set them up, not exactly how I use them. However, I do transanal irrigation due to the fact that I have rectocele and I have a I had a mild prolapse of my rectum. So I basically had to do irrigation to help me basically go to the bathroom, so that it would stop my prolapse from getting worse. However, unfortunately, it has actually made my prolapse worse. As a result of this, my prolapse was actually stopping my bowel movement from actually happening. It was basically trapping it. And it caused some bleeding and irritation, so I was told not to do irrigation until I've been seen by specialists. Obviously this has caused a major issue because obviously if I take laxative medication, which I'm supposed to take up to 3 times a week, if I take it too much, then obviously you become too soft and that can make prolapse worse. If you don't take it, then obviously it can make your prolapse worse because things will be too hard. And irrigation was actually helping me with all of this, so that I didn't have to worry about it. But obviously now that I'm being told not to do irrigation, I'm trying to find I'm finding it hard to get kind of like a good balance in between the two, and regardless of what I do, it's still causing my prolapse to happen. I'm having some investigations done, the first one being on the 7th of September, but you know, it is a bit of a pain because I was just getting in the swing of being able to do irrigation, and obviously that was helping me quite substantially, and now I'm not able to do that. So yeah, that's the first update. I'm not able to at the moment, even though it'll probably help again in the long run. I'm not able to at the minute because of complications. I'm not able to do my irrigation until I've had some investigations done, but I still have the devices, and as promised on those people that follow me on TikTok, I will be doing another video about how I use the Kafora set, because for some bizarre reason the video that I did on how to set up the Kafora basically froze on TikTok, so I will redo that for you guys as well. However, you can still watch it on here, and I think you can watch it on Instagram, but I'm not 100% sure because that might have also been a bit faulty, but we'll just see. Anyway, another update I have for you guys is, as you all know, I went to see a new gastric doctor in May, after waiting 8 months for advice on whether I needed to have my tube placed back again. Obviously within a few days after seeing that new gastric doctor, I was scheduled to have my NJ replaced, which is now my tube that I currently have, which works out well because it's Gastroparesis Awareness Month. Now in that appointment, my new gastric doctor spoke to me about trying a medication called domperidone, which I always giggle at because it always reminds me of the champagne Dom Perignon. So of course domperidone is a medication, Dom Perignon is the champagne. But obviously they don't want me to try the champagne, which I'm so gutted about, but you know. But anyway, he wanted me to try domperidone. Now, domperidone is a antiemetic medication that is used for people with problems with gastric problems. It's also a medication that is used to help women with lactation and things like that. Now, obviously, I do not need to have this medication to help with lactation because I'm not long had I'm not like the person that's like, oh, I've not long had a baby or whatever, because my kids are like, my youngest is like almost 12, so I don't need it for lactation. But because of my gastroparesis, he wanted to try it. Now, domperidone, although it can work for some people, and that's great, it is a red label medication for people with cardiac issues. Now, as you know, I have several cardiac related issues. I have my orthostatic intolerance, I have a dip in T-wave, I have been in AFib a couple of times, although it's not been picked up at a hospital, it's been picked up on my Kardia machine. I have a very mild long QT interval, which is mild enough for them not to have to worry about it or treat it, but it's still present. And obviously I have my supraventricular tachycardia issues. Now, it comes as a red label medication, and it's also blacklisted in America. It's not allowed to be used for people with arrhythmias in America at all. However, in the UK, they still use this medication, but it is red listed, which basically means it has to be used with extreme caution with people with arrhythmia issues. Now, given the fact that, yes, I have found out about my birth family history, and there is several people and several factors with regards to cardiac related issues in my birth family. I've also had cardiac ablation, which is obviously a risk factor, which obviously didn't really work. My troponin is always stuck at 0.4. And obviously because of my SVT and everything else, and given the fact that that has been causing problems lately as well, I don't think it's a good idea for me to try it. Even the doctors, previous doctors, even my older gastric doctor and everything, felt like it was not necessary for me to try it. I explained this to my new gastric doctor. However, he wanted to know from a cardiology point of view whether or not I should try this medication. Now, I've not actually physically seen or spoken to my gastric doctor, sorry, not my gastric doctor, my cardiology doctor since February of 2019, when he put me on a low dose of the heart medication I'm currently taking at 120 milligrams. Then in, I think it was the July of 2019, sorry. I was put on 180 milligrams of the heart medication that I was taking because of the cardiac related issues I was having. Then in the January of 2021, of 2020, they found that I had this long QT problem, and then a few months later I was increased on my heart medication to 240, which is what I'm currently taking. And I've spoken to his colleague, my cardiologist colleague, twice. Once with to do with a scan result, and the other to do with the long QT interval, for them to investigate it. Now, both times this registrar that I spoke to, who works alongside my cardiologist, has written down on the back of the letters that my cardiologist should see me after face-to-face appointments came back round. He was to see me to discuss things with me and to talk about what things need to be done, because obviously my medication needed to be updated again, and he wanted me to be seen face-to-face. My cardiology doctor has never seen me face-to-face or even spoken to me himself since 2019. As a result of this, when my gastric doctor has written him a letter stating, could we try this medication on this patient, which I found by accident because I have a system online where I can basically order my prescriptions and look at medical notes and stuff from appointments and stuff like that. I found this letter by accident. This letter was sent to my doctor, my gastric doctor, on the 22nd of July. stating that this is from my cardiologist to my gastric doctor, stating that my cardiologist had not seen me since, or hasn't seen me or heard anything about me having any cardiac episodes at all for at least the last 3 years. And therefore he's happy for my gastric doctor to take me off my heart medication and put me on this arrhythmic causing medication. Now, domperidone is a medication that is it has a very high prevalence of causing long QT intervals in patients and also causing severe arrhythmias in patients who already have cardiac related issues. And yet my heart medication that I'm currently on is what's keeping me as stable as it can possibly keep me, what is allowing my heart to revert back to normal when it does flip into its abnormal rhythms. And my doctor, who is apparently not heard anything about this over the last few years, is now stating that another doctor, who's a gastric doctor, take me off my heart medication. Now, bear in mind, this letter was referred to my GP, and I was never sent this letter. It was given to my GP as a copy from my cardiologist to my gastric doctor. I'm not due to see my gastric doctor again now till the 3rd of October. However, I am fuming about it, because how can a doctor who hasn't spoken to a patient, hasn't even seen a patient for over 3 years, basically turn around and say that they're stable enough to come off heart medication without even assessing them? They haven't even spoken to me. And yet, despite the issues that I've had and my medications being increased and everything, my cardiologist has not been made aware of all of this, even though he was written to in 2020 saying I was already on 180 milligrams of my medication and that I needed to have it increased. And they said, okay, didn't realise she was already on 180, increased to 240. And that was the last liaison I had. But because it's been a year and a half since I had any issues, apparently, according to him, but he said over a couple of years, which means at least 2 or 3, he's basically making assumptions, and that is not what a doctor should be doing. He should have physically seen me, and he didn't. Anyway, I'm leading this on to the fact that I had a gastric surgical appointment with regards to getting my feeding tube changed from an NJ tube to a PEG-J or a jejunostomy tube. I had that appointment on the 12th of August, and it was determined, we spoke about gastric pacing, we spoke about all these different types of tubes and everything like that, and this letter was not mentioned. This letter was not even mentioned, and I found this letter after I'd been to my surgical appointment. Now, surely, had this letter have been, it would have been up for the computer for the surgical consultant to see, and they've had MDT meetings about me and everything like that behind my back that I didn't know about, and it was still warranted to have a discussion with me with regards to changing my tube and things like that. Now, sorry, the cat just jumped through the window and the dog's now barking. So anyway, I basically, we spoke about different tubes, and I explained to him how I was basically talked down with regards to having a PEG-J tube fitted, because apparently my old gastric doctor made out that it was something that was seriously dangerous, that I shouldn't be having at my age, and things like that, which both the surgical doctor and my new gastric doctor were like, he did what? Why would he do that? And obviously all you guys were like, why would he do that? And obviously, after speaking to a lot of you guys with regards to PEG-Js and jejunostomies and everything like that, I know that a jejunostomy is usually the next port of call after a PEG-J if a PEG-J doesn't work. So, my surgical consultant was like, I don't really feel that a jejunostomy straight away would be the way to go, because obviously it's more invasive and it's a longer stay in hospital, and obviously with all your commitments at home and things like this, we feel like, it's your choice, but we don't think this probably would be the way to go, and it is done laparoscopically, and we know you have problems with this and things like that. I'd explained to him that, the only thing that put me off the PEG-J, other than my old gastric doctor, who was trying to kind of put the frighteners on me about it, was the fact that my anatomy is all over the place, because I have pectus extravagum. So my sternum is, I don't know if you can see, but my sternum is here, And then obviously I have a small bit of bone here, but then my stomach is quite low down. I don't really want to show you my t-shirt because it's got swearing on it. But basically my stomach's round about here, where instead of being lower down. Anyway, so yeah, I was only worried about my clothes rubbing on it, basically, because my stomach's quite high up for my anatomy and everything. And he said to me, like, we could work with a nutritionist, figure out where's the best place to put it so that your clothes are not rubbing on it, so that your upper region is not rubbing on it, and stuff like that. So I was like, well, that was the only thing that I was concerned about originally, which is why we both decided that a jejunostomy would have been better, until obviously he kind of scared me a little bit with what he said about the PEG-J. And he was like, well, that's rubbish. Like, no. He said, yes, obviously you have a risk of any procedure, and obviously you have a risk of your jejunostomy extension flipping a number of times, but it's not something that is severely like invasive. It's something that we'd recommend. And I said, well, one thing I really like about the PEG-Js is the fact that you can actually have them to drain. So like, obviously I have a lot of air build-up because I don't basically get rid of it myself. I said, and that can cause a lot of chest pain because it can get into my chest. I said, and then I'm crippled over. I said, so I like the idea of the PEG-J. I said, because obviously I can open the PEG port, or the gastric port. I said, and basically vent that air out so that it's not causing too much bloatiness. He said, that's exactly why we ask you to try it first. And I was like, well, I'm quite happy to do that. Like I said, we spoke about gastric pacing. The National Health Service do not really do the gastric pacing. There are a few doctors around the country that still do it, but only if you fit a certain criteria, which, because of, obviously, again, if you watch my previous video with regards to BMI, I probably wouldn't hit the criteria because my BMI is still higher than what's classed as deemed normal for somebody with gastroparesis. And obviously I heal very slowly from things, and my body doesn't like foreign objects. So like my nose bleeds with this, I have a really bad sore throat, and my voice is really croaky because I get a lot of mucus build-up because of the foreign body in it. And I know I'd probably just end up with problems with this, like even with having the coil fitted, like I had infections from it because of the fact that I don't do well with like any device put inside me, really. So I was a bit worried about infection, and obviously again it's more invasive to put a pacer in and everything like that. And I said I wanted the least minimal invasive thing possible, and they don't have a good rep for even working. And when I spoke to the doctor about it and said, like, I know they don't have a good reputation for working, they might not even do anything, and obviously you're going through a whole procedure to have something fitted that may not even do a single thing to help you. I said I'd rather not. And he was like, yeah, I totally understand, like, but I have to mention it to you. And I was like, yeah, that's fine. So yeah, we've decided on going for the PEG-J, which I'm quite happy about. And when I asked him, like, I told him that I wasn't seeing my gastric doctor again till October, and I asked him, like, you know, how soon would it be fitted? Would it be fitted this year? Would it be fitted next year? Because I'm supposed to be going away for my birthday. And he was like, oh, we can have it fitted before you go away, and things like that. He said, so, you know, once you see, you know, I know you're seeing your gastric doctor soon, but I will write to him and get him to expedite it as soon as possible so that it's done. And I was like, great, awesome. And then obviously I saw this letter about 2 weeks later, from my cardiology to my gastric doctor, and I was like, what on earth is he playing at? Like, what? Why didn't this surgeon mention it? Like, what's going on? And obviously I've not been able to get to the bottom of it, but with how my heart's been at the moment as well, and I've made a GP appointment because of how my heart's been lately, I can't see my GP even allowing them to take my heart medication, to be honest. So that kind of clears up that part. I also have my hip arthrogram scan due, finally. I had a hip arthrogram supposed to have been done last October, and they put me on the mobile MRI unit, and at 7 o'clock at night, when there was no doctors ready to do it, I'd psyched myself up to having a needle shoved in my hip, with contrast and everything, which is, I get anxious just going to the hospital. So to go to the hospital to have something like that done is like really, really like major. So of course I was not best pleased, as you can imagine. So me and my MSK doctors have been basically pushing and pushing and pushing for this, because the radiology department messed up yet again at my hospital and gave me a standard MRI instead of what I needed. And my MSK doctor has been kicking butt since January. I've been kicking off about it as well because my left leg's compensating for the pain in my right hip, which is obviously making my left leg more painful. And I pushed and pushed and pushed, and finally they've given me an appointment for the 5th of September. So I'm having first investigation for my prolapse on the 7th of September, and I have to lay on my side for that. And with my hip, I'm getting that done on the 5th of September. So yeah, going to be a busy week that week, but I'm just grateful that even though it's took them 11 months, I finally got a date for that. So I'll let you guys know what the results are of that when I get it. And the last thing I have to update on is the fact that you've probably seen a previous video of me talking about late onset of uterine ablation failure. Now, I've had issues with this since I got diagnosed with it, and I've had many issues, and it's just got worse and worse and worse to the point where I've had to go to the doctors and speak to them about it. Now, because I've already had uterine ablation before, there isn't really a line in there that can basically be broken down again via ablation. So chances are the bleeding that I currently have is being caused by adenomyosis or by fibroids. Now, I know that I literally know that I can have I have fibroids anyway, like I already know that. But what I don't know is the fact that where this bleeding's coming from, and it's so regular, like it's like every 5 days or something, like I'm having this problem, and it's obviously impacting on my life. It's making me super tired and everything else. They can't give me another ablation because there's literally nothing there to ablate. So I now have to speak to gynecology in order to probably discuss having a hysterectomy done, which I'm perfectly fine with because, you know, with my age and given the fact that I've been told for many years that having another baby would have been dangerous anyway. I'm quite happy for them to do. It was actually my idea, my suggestion. And they wanted me to have a examination at my GP's first to see whether everything was okay on their point of view, which it would have been anyway, because obviously I'd had my cervical smear, which if you haven't had it, ladies, please go and get it. And that came back normal. So I honestly couldn't have seen it being anything else. Anyway, they did everything they needed to do at the doctors, and they said everything came back normal on their point of view. So I'm now waiting to see gynecology with regards to that. So depending on what happens with my hip, and depending on what happens with my investigations for my prolapse, I could well be looking at 3 further surgeries on top of my PEG surgery, or my PEG-J surgery. So yeah, that's my update. I don't think there's anything else I need to update you guys on, but that is pretty much what I've been dealing with for the last few months. Or especially the last few weeks, which is why I've not been present, because I've had a lot to take in. And like I said, my heart has been playing up a lot. The other day was quite funny. It was like someone was playing the drums in my chest, but on a fast rhythm, because my heart basically went into SVT and then was doing ectopics to try and get itself back out of it. So it was kind of like going bum 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 dum bum 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 dum bum bum dum, trying to get itself out of it, and eventually it did. And the only reason why the hospital has not heard anything about me having any cardiac related issues in the last year and a half is because, 1, my medication has been keeping me as fairly stable as possible, and 2, because of the fact that you have a 15-minute window to seek help. So if self-help doesn't help you, within 15 minutes you have to seek help for any cardiac related or chest related issue. And my heart has corrected itself within a few minutes, so I've not needed to seek help for it. Unless I'm not hearing something that maybe I should be hearing, like unless I'm supposed to get it checked anyway, like I don't know. But with all the dealings I've had with the hospital in the past, I honestly do not want to go for something that has corrected itself if I can help it. So I will literally stay at home unless it lasts for longer than 15 minutes. And then if it does, then I will go to hospital. But if it's correcting itself, then I don't see the point of wasting their time. So I do mention these things to my GP though, but whether they make note of them, I have no idea. But yeah, they're my updates. I will keep you updated with my follow-up for gastric. I will also keep you updated when I get a date for my PEG-J. I'll also keep you updated with regards to my hip and my gynecology appointment. The idea around the hysterectomy as well is the fact that they may be able to help with the prolapses and my bladder prolapse and everything, because it'll have more room for things to be rather than have no room to go. So hopefully that will help instead of make things worse. And yeah, I'll keep you posted on everything as always. Apologies that this video is slightly longer than anticipated, but people did vote that I put all my update in one video. But I do appreciate you getting this far, and if you have, thank you so much for watching. And yeah, for more updates and for me to keep you posted, then please don't forget to subscribe. I hope you have a lovely bank holiday weekend, and yeah, take care and stay safe. Bye guys.